Remember, seniors matter. Of course, you know your host is Brenda Charles Edwards, and we're here every Friday at 12:30 p.m. Pacific Standard Time on www.rainieravenueradio.world, your community radio station. You can also listen and watch us on YouTube and, of course, the Rainier Avenue Radio App. We feature interviews with people that provide services or have valuable information for seniors, their families, and the community. Do you need financial documents notarized? Are you a person that needs documents read to you for clarity or completion? Just give me a call at Black Orchid Notary, 206-683-2636. Tell me where, I'll meet you there. Well, today my guest is Winona Hollis Hauge. She's a graduate of the University of Washington with a master's in clinical social work. She's a former officer of the U.S. Public Health Service, manager of social work for Children's Hospital, Odessa Brown Clinic, outreach manager for Fred Hutchinson Cancer Research Center, and has served as vice president of the Washington State Association of Black Professionals in Healthcare. So this tells you she knows a thing or two. Welcome to the show, Winona. How are you? It's great to see you.
Good morning, good afternoon. It's good to see you too as well, Brenda. And
you
for inviting me for the show today.
Hey, Winona, when I need a healthcare expert, you are the first person that I think of. So it's a no-brainer.
Well, I'm honored and privileged, considering I'm just a clinical social worker. I'm not trying to hold myself out as a physician or a doctor.
Oh, I know.
But I'm always available, and I love being a part of the community discussions around healthcare. That's my goal. That's my interest, actually.
Absolutely. And today we're going to talk about this workshop that's coming up called Dealing with Dementia.
Yes.
And I know you're one of the coordinators. Can you tell me who else is involved in this and how it came about?
Oh, yes, I most certainly will. We are pleased to know that it's Reverend Mary Hobson from Damascus International Fellowship Baptist Church, and she's actually the lead organizer and the key contact person for this. It is a program that's being presented on April the 12th, and it'll be from 9:30 until 12:30, but you have to pre-register for this program. I'm sorry, from 9 a.m. until 1:30 p.m. and you have to pre-register. Again, it's held at Damascus International Fellowship Church, and that's located at 5261 Rainier Avenue South. But again, it's pre-registration, and actually registration closes on this Sunday. So you will need to be in touch with them, and this is how you register. Let me tell you first and foremost, because the time is counting down. You will text or call 206-910-0771. Again, you will text or call 206-910-0771 to reserve your seat in this particular conference program. After we talk today, I'm sure you're going to go right to your text or your phone and reserve your seat at 206-910-0771.
Perfect. So who will benefit from this workshop?
Well, this workshop is designed and set up for caregivers. They are the main people that we're targeting for this particular workshop. And let me stop and say that I have had the opportunity to attend this workshop myself with the pastor, Reverend Broughton, and Mary Diggs Hobson. The three of us have already attended the first program of this kind, just to test it, to see if it was effective for community. We had a full audience then, and we expect to have a full audience again on April 12th. We have been working together with the state of Washington, and we continue to work together on some granting opportunities where churches get involved with bringing health information to communities. And we have partnered now, an ongoing partnership now with Damascus and Mount Zion Health Ministry. And the two of those health ministries will continue to partner to bring good health information to our community. And so who will benefit? well, anybody that has a family member or suspect that you have a family member or that you yourself may be slowly declining in your cognitive abilities, this is a great opportunity to go in and get some information on Alzheimer's and dementia and how it's been impacting our community. You know, I need to pause a moment and tell you that today, more than 6 million Americans are living with Alzheimer's, and over 11 million of them have unpaid caregivers. So we are responding to the unpaid caregiver situation here, because obviously if you're unpaid, you have no money to go and advance your knowledge in a paying forum of any kind. So we are trusting in the community that this is something you might want to know more about. So we're asking you to join us for this informational program. And if you're a caregiver, and see how this disease and what local resources may help you in your care for your loved one.
So Winona, with all of that said, I know that it's a 4-hour class, and I think maybe a little caveat to that is that, folks, if you stay through the whole thing, you get something at the end. Right, Winona?
Yes, you do. Actually, you even before you get to the actual end of the program, you are going to be fed very nicely. You will be a meal so that your sustainability will be good, so you can stay there to the end of the program. But at the end of the program, Brenda, we are happy to give you a certification, an actual official certification, which I have received as a result of doing this program a couple 6 months ago with Reverend Broughton and with Reverend Mary Hobson and with another audience. And so we have a certification that is that lets you know that you have been trained and given information about local resources, about national resources like the Alzheimer's.org, ALZ.org, that you will have the number of resources and guides for your journey in caregiving. So that's kind of what you get towards the end of this.
So see, it's worth attending. And even if you didn't get those things, it's still worth attending, because as Winona said, being a caregiver, I am a caregiver, a family caregiver. So it's not with dementia or Alzheimer, but it's a big responsibility. And there's another section that we're going to get into in a minute that I want you to talk about. But I feel that one of the things that especially family caregivers have to do is have respite care. And we'll get into that in a few minutes. But who else is going to be speaking?
We will have actually 2 presenters from the Department of Health that will come as well to do the presentation. And we have a supporting group, is a private consultant that also has been trained, a nurse consultant who's been trained in the details that will be most important for you as you're learning this. Now, I'm really excited about this happening in our community, because we have also seen now that there are grants for other churches, not just my Mount Zion or Brenda's Mount Zion or other churches like Damascus. They're opening up grant opportunities for community people to who want to get this training to train the trainer. So there's going to be a grant that we are actually have applied for through the state of Washington, where there will be additional resources brought into the community of this nature. And so this won't be the end all be all of it, but it will continue should we be awarded this particular grant to help take a leadership role in the community. And what they said was they were seeking passionate people in the community and faith-based organizations to offer workshops and guide conversations for better health. And that's exactly what we teamed up to do. And that's exactly what you and your church can join us in doing as well.
Sounds great. If you're just tuning in, you're listening live to Seniors Matter with your host, Brenda Charles Edwards. on www.rainieravenueradio.world, your community radio station. Do you know what's the best legacy we can give ourselves and our loved ones? Please join me on Zoom for a group or individual session on legacy end-of-life planning. Now back to my guest, Winona Hollis Hauge, chair of Mount Zion Baptist Church Health Ministry, and one of the collaborators of the Dealing with Dementia workshop that's being held Saturday, April 12th from 9 a.m. to 1:30 at Damascus International Fellowship Church, 5261 Rainier Avenue South, Seattle, 98118. Winona, so you've told them that they have to pre-register and their seating is limited and there's no walk-in, and you've given the number, but I'd like to talk about the 4 areas of help that's going to be covered for those that are caregivers or caring for family members living with dementia. And I know one of the important things is understanding dementia, and then there's managing problem behaviors, handling stress, and as I said, to me, the crucial one is finding time for yourself.
Yes, right, definitely. Those are the 4 areas that we're going to start and focus on. And I haven't been a caregiver for anybody with dementia either, but I have been a caregiver, respite caregiver for both of my parents who had other challenges towards the end of life. And so I know, as Brenda knows, it's very important that you take care of yourself. I'm going to start with number 4, because if I can't take care of myself, then it's hard for me to be in a position to take care of others. And so I think that this, one of the things that I got out of taking this workshop in advance was that caregivers matter, and our health and our well-being matter. So if you can't take time off and have some respite yourself for someone else to help out or share the role, then you run the risk of being very impacted yourself and not able to really give the level of caregiving for your loved one or for preservation of self. So it's very important. I know personally, I normally on Fridays, like I would be at this time, but I'm spending my time with you guys. I play tennis. And let's just say play tennis. Let's go to work at playing tennis at a gym where they have, the ball, you hit the balls, and then you play later. You do, first of all, you do some
it's a warm up.
Yeah. With the ball machine. Then you get ready to go over to the court where the people are playing. So, anyway,
I love it.
Some of us have to start somewhere.
That's right. You got to start. No matter what, you got to start somewhere.
So that's my real passion now is developing. I'm on a tennis club team here in my neighborhood where we take lessons as well, and then we play games. But I'm just, again, that is my thing that I do for myself when I'm not in the community doing stuff for other people right now. So I suggest that each of you that are thinking of something, have something in mind that you're going to do that's going to be sacred, that you do on a certain day that is for you and for your mental health, your physical health, and your spiritual well-being, because I have to pray that I can hit the ball. So.
I love it. So what's the next one you're going to talk on?
The next one I'll talk about is just what is actually, and I'm no doctor, but I certainly have been reading up and researching on things. What is the difference between mild cognitive impairment and, say, full-blown dementia, Alzheimer's? And what I found that's important here is that we have to depend on a clinical assessment to really define. I may forget my keys, or I may forget where I parked my car, or, these are things that, as coming with age, these things happen. But if you find sustained type of things that are your loved one or you are beginning to see are a consistent problem, then you have to start addressing them early. And the first place is your doctor's office, your regular physician. They normally every year annually give you a little test. And part of that test is to see if you can draw the clock. Now if these things aren't happening at your regular doctor annually, I would suggest you make it a point to point that out and just say, I'm here for my regular physical exam, and I just want to make sure that the cognitive part is being included, just in general. And so that way you can start feeling, as though you're in control. That's really one of the biggest things here, is feeling as though you're in control of your own health and not just dependent on someone else to make all the decisions around what is good health care for you. And so it's very important here. And, what you can do if you're not yet evaluated, or your loved one's not yet evaluated, you can just make sure that when they get their Medicare annual wellness, and sometimes, let me just step back. Some people are diagnosed in their 60s and even earlier. So this disease it's a chronic disease, and it can impact you even earlier than the ages that we tend to think that it impacts you later stages, but it can impact you earlier as well. And one of the things that you can do is research mild cognitive impairment. They call it MCI, and just learn what things are like, just beginning indicators that you may need more help. The other thing I'd like to say is there are action steps that you can take. And the ALZ.org is the Alzheimer's.org is the main conduit where you can get on their website or you can call them and just ask basic questions, like, I'm concerned about this, or I want to know more about this, or what resources do you have if a person has already been diagnosed? They have a lot of resources. They have day programs where your loved one can go and spend like a half a day in a day type program. And there are other resources that they can help you with. And again, that's ALZ.org. And let me get a plug for them. They have a sister there. It doesn't necessarily have to be a sister, but we happen to have one here locally in Seattle, who has come out to First AME. She hasn't come to us yet, but we've talked, and she's going to come to Mount Zion. But she's come to First AME and put on a full-blown program online and in person that really tells you what some of the resources are that you can depend on through ALZ.org. So again, please be aware that is a right now resource that you can help. We hope that you're coming to our workshop if you're a caregiver, but we know that if you don't call or text 206-910-0771 by Sunday, that you won't be in this round. But we hope that you will be in touch with Reverend Mary Hobson to save your spot as a caregiver this April 12th upcoming workshop that will be held at Damascus International Fellowship Baptist Church. It's called Dealing with Dementia Workshop. And these are the areas that we're covering. They're talking about managing problem behaviors, handling stress, finding time for you, and understanding dementia. And all those things are there, and they're free for you. You're not going to be charged anything, but seating is limited. There are no walk-ins, and you will need to take it upon yourself today. 206-910-0771. Text them or call them.
And don't forget, there's lunch and a free gift at the end of it.
Yes. And we're always, we don't need all these enticements, but you know what? It's always good to be able to have these enticements. Yes, definitely.
So one thing I want to throw in here, it's not to do with dementia, but Earth Day is coming up, and Earth Deserves More Than a Day returns to Rainier Avenue Radio later this month from the 21st to the 26th, featuring environmental justice themed broadcasts daily from 10 a.m. to 5 p.m. Pacific time. And if you're just tuning in, you're listening live to Seniors Matter. I'm your host, Brenda Charles Edwards. And my guest today is Winona Hollis Hauge, and she's one of the co-collaborators of the Dealing with Dementia workshop that's being held Saturday, April 12th from 9 a.m. to 1:30 p.m. at Damascus International Fellowship Church. She's given you the phone number, and I'm sure she'll give it to you at the end of our show in about 7 minutes. So, Winona, another area I want to talk about that I know you have some expertise in, because you were a recruiter to clinical trials. And can you explain to the audience the importance of clinical trials? And has there been one or two or whatever for dementia?
Yes, thanks for asking. Yeah, I have my experience with clinical trials as a clinical trials outreach manager for Fred Hutchinson Cancer Research Center. I wasn't working in that phase I was working more in oncology for clinical trials in oncology. But at that same time, I was very cognizant and aware that we are doing, the University of Washington has several major clinical trials that are going on now that have to do with early cognitive impairment and early Alzheimer's and other of those neurologically based illnesses. And yes, there are clinical trials open right now where if you would like to be a part of just understanding what level of cognitive impairment you're in, they have those open right now. You just contact the University of Washington, ask them for the clinical trials, or contact Fred Hutchinson, ask them for clinical trials. And you can get easily enrolled in one of those clinical trials. The thing about this particular brain disease is that they can't, it's not until afterwards, by doing more research post disease in this case, they have not been as good with being able to tell us what the early stages are as they are happening in people's lives. It's mostly studying of any of our brains that we want to donate to research, where we will find out more. And this brings us back into what's going on for the football players, because they have also tied this impact, like early impact in head injury, TBIs, traumatic brain injury, those things that are sustained like in the military, loud blasts and things of that nature. I used to work at the VA as well, and there are trials for all of these things. And definitely they are there to help us to kind of get a better idea, a better feel on what does happen to the brain and what does happen when you're impacted with trauma to your head, to your eyes. Speaking of eyes, the head, eyes, and other parts. I got something in my eye, and so I'm.
Wait, you're doing great, Winona. We have 3 minutes left.
Okay. So let's go to what's really important here. What's really important here today, Brenda, what you invited me on here is to make sure that everybody is fully aware that our community and our churches are starting to rise up and take responsibility for working with our health ministries to find out ways that we can be effective in taking better care of ourselves as a community. And today is just another example, with Brenda inviting us in for me to tell you more about the workshop that's going to be held. And it's going to be held April 12th. It will be held at the Damascus International Fellowship Baptist Church, located at 5261 Rainier Avenue South, right in the neighborhood of Rainier Radio. So you can walk on there, actually. And there's pre-registration required. There's no walk-ins. But if you can enroll by this Sunday by texting or calling 206-910-0771, you can be invited to a free caregiver training. You will get a certificate, And you probably will see Reverend Broughton and Reverend Mary Hobson, because they have fully decided that they are going to be a part of bringing this information to community. If you yourself are having just a few things that you're forgetting, or your mind isn't able to function, or you're having like sleep problems, or any number of things that are wearing you down, and you're just concerned with yourself as a caregiver, then I would suggest you attend this workshop as well, because caregiver stress is real. And this workshop is to help the caregiver understand better what they can do to manage their patient and loved one, as well as take care of themselves.
Thank you, Winona. That is so well put. I want to thank my listening and viewing audience for being with us today. I hope that you have a great weekend. And I also like to give a special thank you to MC Class, A.K. Robert D. Bassett Jr. with Delano C. Baychester LLC for the use of his music, Ragtime. So let's hit it, play the music on the way out. Have a great weekend. Be safe. Live your life like it's golden. Winona, I'll see you.